The COVID-19 virus spreads mainly between people in close contact with each other. It spreads most easily in crowded settings, closed spaces with poor ventilation, or through prolonged contact with an infected person. This is because, as a person infected with the COVID-19 virus breathes, talks, coughs, or sneezes, liquid particles of various sizes are expelled into the air. Larger particles are called droplets. Smaller particles are called aerosols. You can contract the virus if infected particles come into contact with your eyes, nose, or mouth. Whether you are inside or outside, always maintain a physical distance of at least 1 meter from others. When you are in an enclosed or poorly ventilated space, the virus can spread more easily. In these conditions, aerosols can remain suspended in the air or travel farther than 1 meter. When you are inside, make sure to stay at least 1 meter from others.
What is coronavirus?
Wear a mask. Open a window to improve ventilation. And limit your time spent in these settings. To protect yourself and others, always follow these 6 precautions.
Coronavirus SARS-CoV-2, which was caused by the disease known as COVID-19, is a member of the coronavirus family that typically affects animals but can occasionally affect humans. Assalamualaikum and a very good day to all of you. It has been 2 years since it became a pandemic that has spread around the world, and along the way, the virus has become more violent. Although most of us has been vaccinated, but it does not mean that we won't get affected by this virus. So, do you know what are the general personal recommendations? No? Do you want to learn and know about the general personal recommendations? Excellent! Let's go!
Prevent diseases, maintain good hygiene.
To prevent communicable diseases, we should always maintain good personal and environmental hygiene.
Ah, you are right!
Hand washing is part of everyone's daily routine.
How to clean our hands properly.
Hand hygiene using hand wash and water. Wet your hand with water. Apply adequate amount of the hand wash in a cup hand and cover all surfaces. Rub palm to palm. Right palm over left dorsum with interlaced finger and vice versa. Palm to palm with fingers interlaced. After that, work around fingers and nails. Rotational rubbing of right thumb claps in left palm and vice versa. Rotational rubbing backwards and forward with clasped finger of left hand in right palm and vice versa. Wrap left hand over right wrist using rotational movement and vice versa. Rinse hands with water and dry with the small handkerchief. Next, Noraliza will show you how to use hand sanitizer.
Assalamualaikum and hi, I am Noraliza binti Ozmi. I will teach you how to hand rub with an alcohol, the best solution.
Apply enough sanitizer to cover all hand surface. And then rub hand palm to palm. Right hand over the back of left hand. Rub the back of your fingers to opposite palm with fingers interlocked. And then rotation rubbing of thumbs. Clean the tips of your fingers and rub rotationally like this. Ta-da! This is the best hand washing with an alcohol best solution. Now, I pass to Arina, my partner, to teach you how to put on and take off mask.
Thank you, Noraliza. So hi, I am Arina Natasha. So, for my part, I will teach you how to put on and take off mask properly.
How to wear a surgical mask properly.
You look sick. I got infected. The doctor said I have respiratory infection. Then wear a mask to protect yourself and others.
Catch it! Hi!
Thank you. How to wear?
So with me, I have two types of masks, which is ear loop and also head loop. So for hijabis like me, I will teach you how to wear head loop mask. So, on this downside pattern, you can wear it on outside, and this upside pattern, you can wear it on inside. Place mask over nose and mouth. Make sure there are no gaps between your face and the mask. Hold the outside of the mask with the palm of your hand and place it firmly over your face. With the other hand, pull the elastic bands over and behind your head or behind your ears. Pull the top strap around the top of your head and below your ears. Take off the mask if you experience breathing difficulties. Remove the mask by touching only the strap.
Don't hesitate to change your mask.
Next, we will show you how to remove a glove.
The World Healthcare Organization recommends using gloves for two main reasons: to reduce the risk of contamination of healthcare workers' hands with blood or body fluids, and to reduce the risk of germs transmitted from the worker to the person they are caring for. You should wear gloves when coming into contact with blood, bodily fluids, or any open wounds, or if there is a potential presence of a highly infectious organism.
I will pass this glove to Hani.
The first thing to remember is that the outside of your glove is considered contaminated. So you want to be very careful when taking your glove off. To remove glove without spreading the germs, never touch your skin with the outside of the either glove. Here, how to remove your glove properly. First, grab the outside of the one glove at the wrist by touching only the outside. Do not touch your bare skin. Pull the glove off from the wrist to the fingertips by pulling it inside out. Place this glove into your palms of your glove hand. Then, to peel off the second glove, putting your fingers of the ungloved hand inside the gloved hand of the top at the wrist. Do not touch the outside of the glove. Turn the second glove inside out while pulling it away. Dispose this glove in a safety container equipment with a plastic bag. Do not reuse. After removing a glove, wash your hand immediately or use alcohol-based hand sanitizer. Rub it until it dry.
So in parting, remember that effective donning and removing of gloves can save lives by stopping the transmission of germs from one patient to a care worker or from a care worker to a patient.
Wow, that's a lot of information in such a little time. I hope that you learned something. Did you? Great, but most importantly, you need to do it on daily basis. In making this video, we do encounter quite a number of challenges. Limited time to prepare this presentation due to our workload in the office and recent natural disaster, which was flood that has affected one of our family members. Having said that, due to our perseverance and patience, we managed to complete this within stipulated time. Miscommunication often happen in making this presentation since we are unable to meet face-to-face. Therefore, we only communicated via WhatsApp. We noticed that the message did not receive clearly by the rest of the team. Hence, we decided to meet via Google Meet to discuss or leave a voice note instead. With that, I would like to thank you for watching this video and stay safe always.